Chester is located in Delaware County. Chester is located 12 miles northeast from Wilmington, Delaware, and 12 miles southwest of Philadelphia. Chester is home to 34,056 people. The racial breakdown of Chester is 69.4% African American, 15.5% white, 11.9% Hispanic, and 0.59% Asian. The median age in Chester is 30 and a half. 12.6% of people speak a non-English language, and 96.7% are U.S. citizens. The economy of Chester employs 11,596 people. The largest industries are healthcare and social assistance, which employs 2,844 people, retail trade, which employs 1,500 people, and accommodation and food service, which employs 1,078 people. The highest paid jobs held by residents of Chester by median earnings are computer and mathematics, health practitioners, and firefighting supervisors. The Chester Police Department is located at 160 East 7th Street. They respond to approximately 4,900 calls for service per month. The Chester Fire Department has two locations. The first is at 1501 West 3rd Street, and the second location is at 320 East 14th Street. The median household income is $27,217, which is less than the median annual income in the United States. In Chester, there are row homes, single-family homes, and apartments. There are 61.9% family homes. At the time of our assessment, there was debris and litter on the sidewalks, throughout the streets, and on residential curbs. Some houses were well-maintained with fresh-cut grass and well-maintained flower beds. However, there were many houses and row homes that were either boarded up, graffitied, and had overgrown weeds. Others were simply not cared for, with pieces falling off and obvious signs of negligence. There is a 21% vacancy rate in Chester. There are 27 churches in total in Chester. We also noticed religious-based schools, which include Faith Temple Christian School, St. Michael's, and St. Robert's. There are plenty of dollar stores, mini-marts, convenience stores, and drugstores in Chester, but we didn't notice any big box retail stores such as Walmart or Target. Chester doesn't have any franchise-owned grocery stores such as Giant or ShopRite. Some strengths that Chester holds is number one, being the home of Widener University, or the place we call our second home. Widener is a 110-acre campus that has more than 40 undergraduate majors and 50 minors, including top-ranked programs in nursing, engineering, and hospitality management. The Talon Energy Stadium can also be found in Chester. It's an 18,500-seat stadium which serves home to the Major League Soccer team, the Philadelphia Union. The Chester Fire Department has a mobile education unit. This mobile educational unit is used to educate children and adults on a wider range of fire safety and preventative data. Various lessons are taught, such as storm warning, proper use of the 911 system, fire safety for seniors, and fire safety in high-rise multifamily dwellings. Chester is also home to Harrah's Philadelphia Casino and Racetrack, where residents can socialize and gamble. Chester's weaknesses include the 36.9 poverty level. This number is higher than the national average of 14%. The largest demographic living in poverty is females ages 25 to 34, followed by females ages 18 to 24, and then females ages 6 to 11. Chester holds a crime rate of 47 per 1,000 residents. Chester has one of the highest crime rates in America compared to all communities of all sizes, from smallest towns to very large cities. One's chance of becoming a victim of either violent or property crime here is 1 in 21. The woman in this photo is a 31-year-old resident of Chester, whose 3-year-old son was shot and killed in 2010 due to a drive-by shooting. There is a sufficient amount of healthcare locations, including the Chester Care Center, the Community Hospital of Chester, and the Crozier-Chester Medical Center. The Delaware County Assistance Office is located on Crosby Street, and the U.S. Social Security Administration Office is right next door. Right across the street from the Social Security Office is the Chess Penn Health Services Center, and down the street from there is the Chester Housing Authority. There is the Saltz's Dental Center and the Wesley House Community Corporation, which is an emergency housing program that helps families and individuals. As we were driving around, we noticed many people smoking cigarettes, and through research, we found that 14.8% of people under the age of 65 have a disability. The top 3 chronic diseases are heart disease, cancer, and cerebrovascular disease. As health community nurses, we diagnose Chester with a health-deficient community related to multiple existing factors, such as negligent home maintenance, lack of resources, and the current physical state of its property and people, as evidenced by high food insecurities and low income rates. Our short-term goal for Chester is, over the course of 2 months, we will establish interested and dedicated volunteers to gather necessary knowledge and supplies to nurse gardens on household properties. Our long-term goal would be that every 6 months, the community will have a farmer's market where individuals are given the opportunity to sell or donate produce amongst each other. To implement these goals, we will provide volunteers with education resources from local farmers from Linvilla Orchards. We will encourage volunteers to chart their progress and communicate amongst one another to seek additional knowledge and support. Good communication ensures a strong community garden with active participation by all. To evaluate the progress that's being made, we will follow up bi-weekly to check up on the status of the individual gardens. To determine the progress, we will need to ensure that they have all of the supplies that they need, that they are continuing to understand the gardening process, and that they are equipped with resources to reach out for guidance if they need it. To decide whether or not progress is actually being made, we will focus on the growth of the gardens. We will keep track of the bi-weekly growth and progress through picture evidence and logs. The garden will be determined a success as long as it is continuing to grow and that there are no halts in the growth of the produce. We and the volunteers have determined a goal of 100 items per garden every 4 months. We have a total of 8 gardens. That equals a total of 800 items every 4 months. 1 item counts as 1 piece of produce, such as 1 potato, 1 onion, etc. Next, we will need to ensure that the addition of fresh fruits and vegetables are actually making an impact on the residents of Chester. The volunteers will start planning in April, and they will be able to start hosting farmers markets in the early summer. Therefore, we will return 6 months after the first farmers market is held to assess the impact of the addition of fresh produce in the client's diets. We will obtain subjective data from the client, including any changes in mood and/or physical changes.